There we go.
Okay.
Okay, great. So the brain misinterprets the world. So dementia affects how the brain processes information, and sensory input can really become distorted, or sometimes it's only pieces of that puzzle coming together. And we sometimes see that somebody's having difficulty navigating an unfamiliar environment, but also navigating a familiar environment. So they might not recognize their home anymore as their home. And so we hear them say, I want to go home. And when the brain is not able to contain all that information, it does tend to fill in the missing information, those gaps. And a lot of times that information is not correct. And so they may say things that are not true. And it could be because that's what's happening. And this misinterpretation is what drives many of those challenging behaviors that we see. So I want to talk about perceptual changes because most families are not told about these things, and it plays a huge role in how you support somebody living with dementia. So people living with dementia have visual perceptual changes that are happening. For one, they lose their peripheral vision. Two, they may misinterpret what they are seeing. So sometimes there could be an illusion that seems very real to them, and they may lose their depth perception. And obviously, that would set somebody up for a risk for falling. So navigating stairs, navigating curbs, all of those visual changes change the way that people are interpreting the world around them. They also have changes that happen with their hearing and sound. So they can become very sensitive to sounds that we're used to having every day. They can also misinterpret what they're hearing. Let's say there's a fire alarm going off. They might not respond to that because they're not interpreting that as a potential danger. They also have tactile perceptual changes. And so there's a lot of things that can happen here, but tactile is our touch, right? So they may have changes in their ability to distinguish the difference between hot and cold. So that could be a safety concern, right? If someone's going to touch a stove and it's hot, but they don't realize that it's hot. They may tell you that they feel cold, but you feel just fine and you think the temperature is okay. They may also have changes in their perception if someone touches them. So I see this frequently where somebody may just gently touch their loved one that has dementia. It could be in a memory care setting too, where the staff are touching somebody and the person really says, ouch, and kind of pulls back. That's because of these perceptual changes. To them, it really is uncomfortable and it's painful. They also can have lack of spatial awareness. So they may not realize where their body is in space. And that could cause them to bump into things when they're walking. That could cause them to miss sitting down on the chair or the edge of the bed. And it also has to do with the way that they find their way through the environment. So if you or I visit a new restaurant or we go to a new airport, we use wayfinding techniques to use the restroom, for example. We look for a sign. But for somebody who's having this lack of spatial awareness and they're having difficulty navigating those familiar and unfamiliar places. They also experience hallucinations. This could be a hallucination of any of our senses. So visual hallucinations where they're seeing things that are not really there. Typically, people with dementia have visual hallucinations where they see people. Sometimes it's children, but they can also have auditory hallucinations. So they're hearing things. And in my work, most of the time, I hear families tell me that their loved one says they hear music playing, but nobody else is hearing that. But they can also have hallucinations of their sense of smell. They may say, "Do you smell something burning?" They can have a hallucination of their sense of taste. Oftentimes, it tends to be something that tastes metallic. And then they can also have hallucinations of touch. So, I visited a new client. She has early onset Alzheimer's disease, and the family said, "Can you please show Andrea your arms?" And she pulled up her sleeves, and her skin was just picked pieces, sores everywhere on her arms. And she's been to a ton of dermatologists. And of course, we always rule out there's an underlying medical condition, but there's nothing that they can find wrong with her skin. So they believe that she's having tactile hallucinations where she feels something is crawling on her skin, but it's not actually there, but she believes it is. And so she's picking. And then delusions. Delusions are really, really difficult for families because a delusion is a strongly held false belief. And it's usually negative, right? Someone stole my purse. Someone stole my wallet. Someone's out to get me. Someone's going to steal my money. My food is poisoned. My medication is poisoned. So those are changes that are happening in the brain that I want you just to all be aware about, because it gives families a different perspective when you're supporting your loved one, knowing that these things might actually be happening to them. So how that perception fuels fear, resistance, and agitation. What feels safe to us can really feel threatening to them. And a lot of times fear appears as anger or a refusal to what we would say be compliant with a certain task or a certain request that we have of them. But these misperceptions really can increase anxiety, agitation, and confusion. I mean, just imagine if you were in a room and you felt that there was a strange man standing in there, you would feel threatened. And so it's important to know that your loved one may be experiencing that. The brain just reacts. There isn't time for reasoning and trying to figure out reality. The brain just reacts. And so that's when we start to see the anxiety and agitation. And a lot of times escalation starts and we're not even sure what caused it. But there's definitely things that we can put in place to kind of hone in on that and figure out what the trigger is so we can be proactive and make sure that we're addressing those things before they happen. So some common behaviors linked to these perceptual changes. I often hear families tell me that their loved one is refusing to bathe. That's a big one, right? Not wanting to bathe or maybe get dressed or change their clothes or even change their incontinence briefs. But again, there are strategies that we can put in place to make those things easier. Sometimes there's agitation during busy or noisy times of the day. I think sundowning is also a challenge where
Andrea,
sundowning,
can you hear me?
yes, I can hear you, yes.
Okay, you went blank for a minute. I'm not sure if I was the only one or did that.
I do not see your video feed anymore, but I see everybody else's.
Okay, good, good. Okay, no,
Okay.
everybody says you're fine.
Okay. So sundown